All right, Annalise, thank you very much. April is Alcohol Awareness Month. Alcohol abuse affects millions of Americans, more than 8% of the population. And addiction actually hijacks the brain, and it changes the way the brain functions. Joining us now is Ned Presnall with Clayton Behavioral, and he is here now to talk about the month of April being Alcohol Awareness Month. Ned, you treat alcohol as an addiction, not as a personal failure. Tell us about that.
Sure. So yeah, alcohol meets the criteria of a lot of other chronic illnesses. It progresses over time. It's very much out of a person's control. Nobody makes a decision to be an alcoholic. They make a decision to have a drink over time, and over time illness develops. And so you talk to any alcoholic and no one will say, yeah, I really wanted to be an alcoholic. They deserve as much compassion as someone with any other chronic illness.
Sure. And is there a sense or a emphasis on personal responsibility as well?
You know, it takes some responsibility to get well, but it doesn't take one big choice. The choice to recover from alcoholism is, I always tell people, it's 100 or 1,000 small choices. And the person with alcoholism can make those small choices with help, with guidance, but it becomes impossible to make that big choice, I'm just not going to drink.
Mm-hmm. Now, what is the spectrum, I guess? Is it basically the people who fall into that? There's a gray area here about people who may have no drinks at all, and those who just can't wait to have a drink and live for it.
Yeah, and I think Alcohol Awareness Month is a really good time to highlight that. 30% of Americans don't drink at all. Another 30% of Americans have less than one drink a week. So the idea that heavy drinking is normal in America is not really true. Heavy drinking is the exception. Now, even among heavy drinkers, you know, 8%, as you stated at the beginning, 8% of Americans will qualify for an alcohol use disorder in any given year, but only 1% comes to treatment. It's only those most severe cases of alcoholism that we get to treat. And we would really like people, when they start to develop some difficulty with alcohol, maybe think they're drinking too much, maybe they've gone from the 2 drinks a day that the CDC recommends as a maximum to 3 drinks a day, which we just learned in the last couple months with a new study, puts you at higher risk for liver cancer. That 3rd drink a day. We would love to start treating people earlier in the progression of alcoholism rather than only seeing the most severe cases.
Do you hear often from someone who has an alcohol problem, or is it more likely you'll hear from some family member or friend?
Usually the person themselves comes in for like a consultation with me, and they bring family members. And a lot of times the family member is encouraging them to come. But let me tell you, people with alcoholism and addiction have a sincere desire to stop. I haven't met one that doesn't have a sincere desire to stop. It is just very difficult.
Yeah. All right, let's talk about treatment. You brought this up a little earlier. We've heard of detox. We've heard of other treatments. What do you offer at Clayton Behavioral?
We offer comprehensive treatment. And so what that means is a person might get a medication that helps decrease cravings. Obviously, they get medicine to help with detox, which is an issue of safety and comfort. And then cognitive behavioral therapy to learn what to do with the triggers and associations that spark the cravings. And a lot of it is about craving management. If people's cravings for alcohol aren't controlled, or if they don't learn ways to cope with those cravings or avoid those cravings, it's very hard over time to sustain the intention not to drink. And so we really teach them how to manage their cravings, both pharmacologically with medication and behaviorally and cognitively.
Do you employ Alcoholics Anonymous?
We strongly support Alcoholics Anonymous and have some Alcoholics Anonymous groups at our clinic. But within our treatment groups, we use motivational interviewing, cognitive behavioral therapy, evidence-based practices for the treatment of alcoholism. AA is a great adjunct as a mutual help support, and it's part of the whole treatment package.
And what about an age group? We hear a lot about underage drinkers. If someone who is a teenager and is exposed to drinking, are there statistics that say whether or not they're in danger of alcoholism later in life?
For every year we delay, or every month even, we delay the onset of drinking in teenagers, their risk for developing an alcohol problem dramatically decreases. And so if you have someone starting drinking at 13 versus 18, there's a dramatic difference in risk for alcohol use disorders.
And what do you see in terms of the cooperation of family members? You said they often bring in family members with them.
That's also a spectrum. Some family members really understand that this is an illness and that they provide really good support to their loved one to get well. Others, collude in the denial and the sense that, well, maybe it's not as big a problem. Or even worse, look at their loved one as, boy, this is something they've just got to get together. It's a moral failing on their part. We just need them to decide not to drink. Get them to decide not to drink. And we have to then educate that family member and say, it is an illness, and we can provide the resources to help the person get well. But the person also needs compassion and support as they go through this process. It's very challenging.
And anyone who wants more information can go to ClaytonBehavioral.com. Is that correct?
That's correct, or they can call me directly at 314-222-5896.
All right. Ned, thank you so much for being with us from Clayton Behavioral. Anyone who wants more information about alcohol awareness, April is Alcohol Awareness Month. And if you or someone you know may have a problem, please contact ClaytonBehavioral.com. Ned, thanks so much for being with us.
Thanks for having me on.
We appreciate it.